Oh,
A 1,
whatever.
yeah.
1, okay, good.
But
Good,
we'll,
we're good.
we'll make it work.
Sure.
All right. Welcome to DC2B Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Cliff Hardick. He's been in private practice for nearly 50 years, and he's currently the executive chair of Maximize Living. He's been the chair since 2017. He's taught everywhere, shared everywhere. So excited to have him on the channel today. Dr. Hardick, you're going to be at CalJam coming up here in a couple weeks. Can you share a little bit about what you'll be speaking about there, and what's the, the message that you really want to get out there for folks?
The message I want to get out there for folks at CalJam, Noah, is that, practicing an inside-out model rather than an outside-in model is what you have to go to if you're going to be a successful chiropractor. Some chiropractors and students, they decide to practice an outside-in model. So now you're competing with every outside-in model that's out there. You're competing with physiotherapy, you're competing with pharmacists, you're competing with over-the-counter drugs, you're competing with massage therapists, physiotherapists. All those are outside-in models. True principled chiropractic is about an expression of life. True principled chiropractic is not about, do we take another x-ray and we change the position of the bone? It's all about, does the mother of that kid figure out that I don't need to give my child Tylenol to lower their fever because I recognize an inside-out healing process in my child's body? My child has an innate intelligence or a wisdom inside that needs to work right so my child can respond to its environment and my child can heal in whichever way he or she chooses. That's the only way people get well. It's the only way people really get better. Anything else is symptomatic treatment. And to be honest with you, I've been in practice 50 years now and the people that I know that are in practice for 30, 40, and 50 years, they don't treat symptoms. They don't run from modality to modality and treat outside in a different method every 5 or 10 years. A lot of friends I know that do that, they eventually burn out. They're gone.
Yeah. And so, as a student, I'm at a college where we talk a lot about the inside out model. We talk a lot about kind of maximizing people's potential and, helping to remove that interference so they can live this fuller life. Do you feel like that chiropractic practice that you did 50 years ago is kind of the same that you're doing now, that your ability to help people express themselves from the inside out has changed at all over that time?
I'd say in some ways it's become a little more difficult because we now have, in my opinion, more chiropractors practicing inside out philosophies with injections, stem cell injections, outside in therapies, low current, acupuncture, electrostim, so that we're giving patients the idea that that's chiropractic. When I started in chiropractic, if you went to a chiropractor and you were going to change chiropractors, it was usually because you had a problem with the guy's personality, or the guy did something you didn't like, or maybe you didn't like his particular style of adjustment. Nowadays, we get people changing because they're trying to find a chiropractor that's going to adjust them. So when I went to school, Noah, we came out of the model that if your spine was crooked or bent, you had nerve system dysfunction and you were sick. I don't think the average student that graduates today owns that principle. They wanna, but they don't. So you asked me, what am I going to talk about at CalJam? I'm going to talk about how you change who you are, how you become a different person. And now I know to a student, we're not going to change you to go back home to change in your community to serve your patient. But my goal at CalJam is, and I'm sure Billy's goal is, that more people, hundreds of people that come there, could become a different person when they go back home and make a transformation that lasts forever. That's a big wish. That's a big wish. That's a big wish list. But if we don't have a big wish list to transform doctors, we're not going to achieve very much. So the way people do that, the way doctors are going to do that is they have to acquire a stronger ownership of the principle that we practice. Because when you practice, patients are continually trying to tear you down to take you to their model instead of you bringing them to your model. When I was a young fella, I heard Reggie Gold say, you know, you got into chiropractic to change the world, but instead the world changed you. When Reggie said that, I didn't quite know what he meant. I do know what he meant now because I see it all the time. People change because the insurance codes change. People change because I can do this or I can do that, and insurance will pay for it. Well, you're just a jack of all trades. You're not a chiropractor. Or you're selling products and you're not advertising yourself out to be a chiropractor. Are you trying to earn a living, or do you want to be great? Do you want to be great and do you want to do great things for the people in your community, or you just want to earn a nice living? So there's a big difference in that model, I think, of student that's in chiropractic school now because of the educational system and because of the outside in things that a lot of chiropractors do that are perceived to be principled chiropractic. And many of those things are not principled chiropractic. Why do you want to practice something that's in the public domain when chiropractic is autonomous from everything else that exists? Nobody is willing to reduce subluxations to increase nerve expression so the patient's body can respond in whichever way it chooses. Nobody else does that. So if nobody else does that, why do you want to spend all your time in school and then go out and practice something that's in the public domain that you don't even have to have a professional license to do? I don't get it. So some of those things are publicly accepted and easy to sell. And when I say sell, I mean easy to get the public to accept them. You know, we need to get better at, and so I'm going back to answering your question about CalJam, we need to get better at ownership of what we do, communicating what we do, and communicating it to other doctors, and then having our doctors be able to communicate that to their patients so that their patients can communicate that to their family, friends, and neighbors so that we change the environment, period. And I mean meaning the environment, the reason they go to a chiropractor. So they don't come to get their headache addressed. They don't come to get their back pain addressed. They understand that see, the practice of chiropractic isn't just a principle. Chiropractic is not a profession. Chiropractic is a way of life. And we need to be that standout model. You need to be that person, Noah, that when you get a license and you start practicing, the people in your community recognize there's something different going on in Noah. I want to be like that.
Yeah, and let's dig in that a little bit deeper, because you mentioned this earlier. You mentioned this idea earlier of, you know, what you're offering as CalJam is you really want people to transform. And, you know, as a student, chiropractor school is more expensive than it's ever been. And so, of course, there's a lot of external stress on me to find a modality, do a technique that is going to ensure that I can pay back my loans. So I want to dig into this ability to really root inside myself and find integrity inside myself so that I'm not pulled by those different options that are out there. So what would you recommend, or how did you really, you know, do the self-growth to get to that point where you were not so affected by the outside forces?
That's a good question. I didn't have as many outside forces to influence me as students do today, quite frankly. I'm not saying I'm big and powerful and strong and would have not succumbed to some of those forces. I don't think I would have, but I didn't start practice in the environment that exists today. I think you young students are getting pulled on, you're getting sold to, and I understand that you've got student loans and it's tougher. I can tell you this though, and I'd ask you this question: do you think history repeats itself?
Yeah.
History repeats. That's the right answer. There's no other answer. history repeats itself. So I'm going to tell you this. The only people I know that practice principled chiropractic are anchored to the principle, have always practiced the principle, have practiced the same way for 10 years, 20 years, 30 years, 40 years, 50 years, and have the same passion today that they had when they started. I don't know anybody that's practicing a different modality or has changed modalities or changed his outside-in method of practice 3 or 4 times over a 50-year career that has the kind of passion that I have and my peers have that graduated when I started. I know there's a couple of youngsters that are teaching practice technique at the school I graduated from because they have a passion to continue to help students learn to be good adjusters. They're not doing that because they need a job. They're doing that because they're still passionate about it. They're just as passionate about it as when I was their classmates. So, you know, they're in a different role than I'm in, but they still have that passion to, and you talked to me, you asked me, when you phrase your question, to learn a technique. I wish the biggest problem that we had in chiropractic today, and I just covered this with Billy DeMoss, I wish our argument, I wish our battle, I wish our fight was that we were arguing about what's the best technique. Because at least then we'd all be on the same page. We'd be fighting for a better way to reduce the subluxation. When we get on that page, you don't have to worry about your student loans. When you own that and you know that deep in your heart, where you're not thinking about it, trying to make a conscious decision, when you own that, you don't have a problem. People are going to come to you and you don't have to tell them you love them. You don't have to tell them you're different. They're going to see that you're different. When people go to Billy DeMoss's office, do you think they know he's different?
Oh, yeah.
Sure they do. They know. You need to become that guy. You need to become that guy that lives, eats, breathes, sleeps, walks his talk, never wanders, never strays. You need to be that rock that your patient can anchor to.
Yeah.
And that's a lot of work. You got to work, work, work. And you cannot do it as an island. You know, I was telling Billy earlier that about 10 years ago, all my mentors were gone. Dr. Sid Williams died. Dr. Parker died. Recently, I went to Jim Sigafus's funeral a few years ago. Everybody, Reggie Gold died. So my son last week said to me, "Who's your mentor?" I'm worried about you, Dad. Like, who's your mentor? I thought about it. I thought, yeah, I'm not sure I got one. Yeah, I got one. It's Noah. It's the youngsters that are coming behind that need to get this. You guys are my mentors. You guys need this. We need, you know, so maybe I'm an anchor to the past. I was telling Billy that I learned Gonstead technique from Clarence Gonstead. You know, I mean, there was no light force adjustment when I started to practice. You moved the bone. You didn't figure out the way to cause the least interference in the patient's gray matter because they were evaluating how you were going to do this. It was the bone's here, we're going to move it here. And so when I started, if the bone's in place A and it needs to be in place B, we're going to put it in place B. Because I knew when the bone's in place B instead of place A, you're going to get well. Because your body's going to be able to comprehend itself better. And then we're going to not drug you to death because we want your body to be undrugged so it can comprehend and respond in whichever way it wants. That's what principled chiropractic is. So you guys need to get this stuff. I'm telling you, Noah, if I've got one message, I don't know anybody that shifted and changed that's still here today. The people that shift and change and go with the currents, you're going to wash up on shore. There is no washing up on shore for the principled people. Like Clarence Gonstead, like BJ, like Jim Sigafus, like Reggie Gold. You need to, like Billy DeMoss, you need to get on fire, walk the talk, figure out draw a line in the sand, figure out the side you want to be on, get over there and stay there come hell or high water. Doesn't matter what everybody does. It doesn't matter if they change the insurance codes. It doesn't matter if you can bill $80 for an adjustment because you lie, because you treated a symptom. You know, I remember a day when I could wrote in brachial neuralgia and got paid. But I wrote in C6 adjust subluxation. And I'm not changing that. And if you don't pay me, tough shit. I'm not writing in brachial neuralgia to get paid. I am not doing that.
Yeah. So I know
Now,
a lot of students resonate
if you
with.
write in a diagnosis to get paid, you're not principal.
Yeah, I know a lot of
That's a
students.
tough one. That's a tough one. I know
Yeah,
you got student loans.
that is a tough one.
That's a
So
tough
I
one.
know that a lot of students resonate with this message that you're putting out there. So do you have a website, Facebook page? What's the best way for students to get more information about this and kind of go down this path that you're presenting?
So, as you know, I'm the chair of Maximize Living. We have a website. It's one word, MaximizeLivingChiropractic.com. All one word, MaximizeLivingChiropractic.com. You can go on there. You can look up our seminars. You can get some direction about what it is we're doing, what we're doing at seminars. And, Maximize Living seminars, and we've changed our name to Max Living now, are free for students. If you become a doctor, you don't have to join Maximize Living. You don't have to buy coaching. You don't have to become a Maximize Living office. You're welcome to come. Hang around with successful people. See what it feels like to hang around with people that are just adjusting patients and doing other things that support the adjustment so the patient can heal themselves from inside out.
Yeah.
There's few places that you can do that nowadays. Max Living is one of them. Principal chiropractors have to unite among we need to unite among ourselves instead of fighting about it. And we need to unite on common ground for what we have that's in common. And you said it earlier that you figure out the best way to adjust the bone. I'm all in favor of that. You know, what's the best way for you to adjust a bone might be a different way for one of your fellow students. That's still the principle of chiropractic. That's not going away from the principle. If you're changing the position of a vertebra in the spine to improve neurological function, that's the principle of chiropractic. That's all chiropractic is. It's not about rubbing and squeezing and heating them up and cooling them off. That's outside in. Anybody else can do that. Why do you want to compete with an ice pack? I don't know. You know, if you change the voltage in a patient, do you think you enhance the innate or do you think you shut innate off?
I don't know. I don't know if there's any research on that.
Well, I know if you're running around with a laser or an electro stim, you're interfering with the body's natural ability. Your body's got every chemical in here it needs to make. You know, if you're drug free, you got a better chance of functioning normally. If you're drugged up, you got less than a better chance of functioning normally. Are there times you need medical practice? Absolutely. It's done great wonders in trauma care. There might be times you need medication because you're in such pain you can't function anymore. But there's a better way, and a better way is not get that bad in the first place.
Yeah, I completely agree. And I know that, there's a lot of students that are going to find you at CalJam. They're going to ask you a lot more questions. I'm so glad that you came on the show today. This has been a production of DC2B Revolution, helping chiropractic students think big to live large. Please subscribe to the channel, share this video, like it. Whatever we can do to get this message out there so that more students can get on board. And Dr. Cliff Hardick, thanks so much for being here.
You're welcome. You're welcome. And if you have questions, you can send your questions into that website as well, MaximizeLivingChiropractic.com.